this is Leslie Ziegler, and I am here at the Digital Health Summer Summit at UCSF, sitting with a very special guest, Mr. Yves Béhar. And I have to say, it is delightful to see, such a leading mind in design at an event that is squarely focused on digital health, which is an area that I think has been, in need of really, really intelligent, big thinking in this area for a long time. So first of all, welcome.
Well, thank you for having me.
It's great. It's great to have you here. So I'd love to hear, for everyone who was not at the event, what did you cover on stage?
I think when people experience health and healthcare, when people think about healthcare, they don't really think about design, and I think that's a huge missed opportunity. But because at the end of the day, we're trying to take care of people and their emotions, their physical being. I think design can make a big difference in the space.
Yeah, and it's certainly been an area. We talked to Cardio earlier. They're trying to make some, really beautiful devices. Obviously, Jawbone and a number of others in this space. But what really gets you going? I'm curious. If you were, obviously you're sporting your company swag here. You're double fisting even. Product testing. But what's a problem that you're really interested in solving right now? Something that you haven't seen anyone go after, maybe outside of the context of even what you're working on now.
What I'm really interested in is how do you keep people engaged with a product 24/7, 24 hours, day and night. People, what I've discovered in the last 3 years or so is people love their data. They love seeing the patterns of how they live, how they sleep, how they eat, how their moods and their stress is affecting their lives. They love seeing that over a day, a week, a month, and years. And so how do you give them this data in a way that is not a burden on their lives? It doesn't feel like you're wearing a medical device. It doesn't feel like you need to remove it, or it's impeding your everyday activities. And so I'm interested in having the technology, I would say almost disappear, but become a personal accessory, become something that you can wear, something that you can you can feel proud of having. And that's very different from a medical device. But what about if medical devices, things that get more data out from you, things that it's important that you use them, that there is sort of compliance, etc. How can we go further with what's today in existence?
Yeah. Would you ever design an implantable device?
Absolutely. I think the experience of an implantable device from when this is presented to you and the procedures that come with that, all the way to the data that comes out of it, and how you live with that data, how you share that data, how it reveals itself, how it gives you insights and learnings. I believe that can be an important experience. That is an important experience in somebody's life. So let's make it really count.
Yeah, I think it's, what you do in consumer, more consumer-facing things. The medical device industry really could and should learn a lot from you. The big guys could, really infuse more of that thinking. What do you think holds them back?
Well, to me, it's what are the top 3 to 5 questions that you're asking yourselves when you make a product, when you create a new experience, I doubt that delighting a user, delighting your patient is in the top 3. I think there's probably things like it has to be precise, it has to be durable, it has and all those things are important, and design should takes them into account. But what about delight? Because it's medical, I think a lot of companies assume, well, they have to wear it anyway, or this is something they have to do no matter what.
Or it's a low margin product.
And but I do think that the emotional benefits, the personal satisfaction, what people derive out of an experience that maybe initially is not a positive experience. It certainly isn't something that somebody would elect to do. But how can you turn that into a positive? How can you give them actually a surprisingly positive, delightful experience, and a lot of learnings out of that.
Great. Yeah, I just went through an experience where I was on crutches for 3 weeks, and now I have this very, yes, I have this very attractive medical boot, and there are no alternatives for me. I mean, I'm making it work as best I can, but I would love to see more industrial designers take a crack at crutches, which that patent was filed in 1975. I mean, what do we have to do to make this fundamental thing that affects so many people while they're healing?
Absolutely. I mean, my father is on crutches for like 6 weeks. Right now, and I've been able to sort of give him all kinds of fun objects and experiences through my work, but certainly this is one that's terribly missing.
Yeah, maybe this is your next project. I would be very excited if you redesigned crutches.
Bring it to me and we'll do it.
Consider it done. Anything to leave all the health and design wonks out there with? What do you see coming down the pike? What are you excited about?
Well, I really think that healthcare is the last frontier. That in many ways design here in the developed world hasn't really touched that deeply. And so for me, it's a fantastic opportunity to make a difference. I mean, really to make a difference in people's lives, and I believe that it's also a tremendous opportunity, from a business standpoint. But I'm interested about why do you want to do it in the first place? It's definitely going to make people's lives a lot better.
And the personal motivation really, I think, makes everything stronger. So, anyway, really appreciate you being here today. It's wonderful to see a leading mind in design really apply those skills to health, and hope to see many more things. And don't think I was kidding about the crutches. I will report back.
Let's do it, and thank you.
Thank you so much.